Drug abuse, especially among youth, is a global health concern, and Nigeria, like other countries, is plagued with the menace and how to effectively curb it. The National Bureau of Statistics 2018 report on drug use in Nigeria put the prevalence of any drug use at 14.4%. Some Nigerians say the fight against drug and substance abuse ravaging the lives of youth requires a holistic approach.
About 10 years ago, when I actually joined the parastatal as a social worker, I usually see that about maybe like 60% of our mental patients, not because of the abuse substance, but these days about 70 to 7.5, 70.5% are numbers of patients that comes down with mental illness. So, which is alarming. I want to tell our parents that they should be very observant. The guardians should be very close to their words, and they should know when there is changes in their behavior of their children or the children they actually oversee, and they should monitor them properly and make sure that they actually look at the kind of friends they move out with, because most of the time it is peer pressure and the environmental factor that usually leads these youths, the young ones, into drug use, and then which later becomes addiction.
Churches, mosques, parents, schools, everywhere should pay attention to teenage activities. And in some cases, parents themselves are bad examples. Fathers, mothers are drug consumers. So, what do you say with respect to their words? They would be like their parents. So, parents should set good example.
The society too has a role to play. If you look at it the way it is in our society, we are free to just go to any chemist and buy any drug. It's not like that in saner climes or in developed countries. You are not just free, you are not at liberty to just enter any pharmaceutical whatever without prescription sheet, and you just you go and buy antibiotic or any other drug. I think in this area, maybe the government should start regulating how you can just, the kind of drugs you can enter the chemist and buy.
Government may organize sensitization program that will educate people about the effects of the drug abuse. That when you take drug, this is the consequence, and it's better you don't take. And when we are talking about drug abuse, don't only when you are taking the hard drugs, when you are misuse the drug, when you are sick and you don't go to hospital and take prescription from the doctor, you are just go to the pharmacy to just get I have malaria, let me just go to the pharmacy. Maybe government or agency in charge of that should monitor all these chemists and check that and make sure that they have real pharmacists there, so that even if they get prescription from the hospital, they will give them the correct drug.
One of the ways by which I think we can curb it is by doing a public sensitization, just like we are doing now. Public on the effect of it on our health. So many youth are outside there, they have brain damage, they have kidney problems, they have mental disorders. So when people know the after effect of drug abuse, you begin to make them have a sense of reasoning towards stopping abusing drugs.
As a parent, I can understand the pain a parent will be facing, having to deal with their world in being addicted to different substances. I would advise them that when they find themselves in such situation, they really need to help their world to understand that there is need for them to get help. Maybe get them to, to homes, rehabilitation homes that can help them detoxify their system and, give them an opportunity to see how bad these substances is destroying their health.
treating drug addiction, it's not very easy because they tend to relapse, they tend to go back to smoking. For example, when they come in and they are being rehabilitated for months, being away from medication, they being detoxified, and also try to teach them the mechanisms to use in order to say no when they see this substance. It works for some time, but with time, they tend to relapse. Although we have recorded several successes, whereby some of them are even being invited over to speak to other patients or other people that are willing to stop the use of substance. So it is not very easy, most especially because we don't really have the facility that is enough to actually cater for people that are into drug use, and coupled with the fact that it is not being supplemented, like the treatment of drug addiction is very expensive in Nigeria.
Schools, families, parents should provide support for those who are already caught in the act of drug abuse so that they can be healed. It takes a process of time. That's why we talk about support. Now, so they must build consciously, a support system that will help those who already are in it to get out of it. And it is a collective effort.